Have you ever wondered exactly how much better you're supposed to feel after taking a medicine? Now you can actually find out. On May 17th, I'm giving a talk in the community about knee pain and the different treatments that we can offer to help minimize that pain. The great news is that over the past few decades, doctors have been collecting information from patients using something called patient-reported outcomes. The whole idea was to find out how effective a treatment was after it had been used. Thankfully, enough people have been using these tools to measure the effective treatments from over-the-counter medicines to surgeries, even physical therapy, and now we can use that information to help predict how much better people are going to feel after using these tools. It's actually very simple, but very powerful, and I think it's going to create a shift in how we talk with patients about their treatments. So, how about I take you to my office and we check out some of the tools and how effective they may be for people just like you. How much benefit should you expect from any of those treatments on the treatment spectrum? Well, when we look at patient-reported outcomes and adjust them so that we can view them on a 10-point scale, we need at least 1 point of benefit for most individuals to even notice a difference. So let's start by looking at tools over the counter like NSAIDs, non-steroidal anti-inflammatory drugs. How much benefit would you expect to get from those if you have arthritis? Well, when you look at those medicines over the course of weeks, most individuals who take the prescription dose get just under 2 points of benefit on a 10-point scale. And that benefit happens within days. And it can last. You just have to use those medicines regularly, hoping to avoid some of the side effects, like stomach dysfunction. Some people like to come to a physician to try and find other tools that allow them to get the same types of benefit or better benefit without having to take medicines quite so regularly. Some of the tools that I recommend start with steroid injections into the knee. How much benefit do you get from those? Well, you can get just under 3 points of benefit on a 10-point scale. However, that benefit increases over the first couple of weeks, but then slowly decreases between weeks 4 and 12, to the point where after 12 weeks, the benefit is really hard for most people to even identify. Whether I'm using injectable medicines or if I'm using oral medicines like NSAIDs, I always recommend physical therapy. Over the course of 6 weeks, structured physical therapy can reduce individuals' knee pain by 1.5 points, 1.5 points. That may not seem like much, but the benefits can last for months afterward. And if you keep up with those exercises as part of your own home exercise routine, we presume those benefits are yours permanently. And that's great. For end-stage arthritis of the knee, sometimes we need to use a total knee replacement or a partial knee replacement. These tools are usually held out until all other tools have been exhausted. But when we use them, we still want to improve pain and function as much as possible. So how much benefit would you expect to get if you had a new mechanical knee replacing your previously injured one? That type of surgery usually gets them about 4 points of benefit on a 10-point scale for pain and function. That is significant, but it may surprise you. You may have expected the number to be a little higher. That's why it's so important that you discuss with your physician the types of treatment, the amount of time you have for recovery, and the resources available to help address any of the issues, especially knee pain, that you may be dealing with. So as we hear back from patients, physicians get better at communicating with you exactly the amount of improvement you should expect from the treatments that we recommend. Whether it be over-the-counter medicines, the use of physical therapy, new injectable tools, or even surgery, we are now getting to a point where we can help predict the improvement that you should expect.